You know, in this class that we're going to work into today, the layers of movement are quite interesting for your, for kind of the whole cycle of sensitivity and connection with your legs and your core into your upper zone. So what I want to start with is sitting on our chair now. So we're sitting facing to the wall, and you'll put a block or a ball, you could use that as well, the small ball, between the knees. And if you have something where there is ability to create a connection of pushing inwards to that block, okay? So feel where you're seated towards the edge of the chair, and then reach the arms back so that you're holding on to the arms of the chair, right? The top portion of the chair above the seat. But you're welcome to reach around to the seat if that is interesting for your chest muscles. So begin with managing the circulation in your seated upright position. Let the eyes close and coordinate the movement of the breath as it motions in through your nose, and your abdomen is relaxing. And as the exhalation experience is the air leaving the body, or the CO2, and your belly draws towards the spine. So working on that conscious control and release of the airflow. And feel how the shoulders are propped back. And if it's a strain in your arms, you're always able to scoot back in the chair, and it will reduce that pressure in the upper arm bones. But if it does feel a strain, you might feel what you can do with your walls of the chest. And let's take this to a light twist. So we're going to keep the left hand, so it's either holding the arm of the chair and it's kind of slid inside. So I like to hold to the seat of the chair personally. And as I turn to the left, I'm going to bring my right hand to the outside of that left leg and guide your focus, even if you let your eyes go back to that soft gaze or closing, that you're considering what rotation has occurred in your insides, right? It becomes a complete shift in your musculature of your stomach and your shoulder. Not complete, but it does start to guide some circulation. Okay, now come back and center. We're going to do 2 of those, but we'll be mild on the first side. So then as you turn to your right side, left hand to the outside of the right leg, feel how you reach to that leg with your left hand. And do you let the hand relax on the leg? Do you tend to push and force? Feel if you can let the hand have a little bit more kind of a 50-50 pressure. And as you turn, use the right hand to guide 70% of that twist. So I guess we're going now to shifting the percentage even different. But feel where the shoulder connecting down into the right lat, into the back muscle on the right side, helps you turn like it's a fin, like your back is a fin that's helping you rotate, your dorsal fin. And now as you come back to center, let's bring the arms interlacing at the hands forward and straight up. And feeling where the soles of the feet relax. See if you can be in your bones where your feet are on the ground, but they're not forcefully pressing. And you guide a sense of the legs still holding on to the block. But as you turn this time, the final time to the left, be a little exploratory on this guidance for your left twist. So the right hand comes down to the left leg, and the left hand might reach back to the bar or down to the seat. I'm going down to the seat again. I like to work on occasionally getting back around to the bar and getting more of that direct rib rotation, but it really depends on where you feel accomplished in your lower belly. So if it feels like that area kind of drops when you get a little high in the arm, depending on your length with your arm, then you might stay a little lower, but it's really individual. They're both pretty interesting, right? And this whole waist area, you know, since you're in your little home practice, you might get a touch there and kind of feel that you're getting those smooth muscles, which is the core organs, like there's smooth muscle motion to the left. And then I want you to come back center, reach the hands together, but feel the elbows in a strong opening. And then round your back so you have the scoop of the core like a cat spine. Inhale, center and lift up the ribs, and the elbows are wide. So the hands stay just above your brain. Right? The elbows have a tendency right here to stay open. Fill the lungs, but feel the ribs expand. And as you exhale, twist to the right. And the left hand to the outside of the right leg. The right arm might scoop up the back of the chair just naturally. And you might put that hand on the seat. One side, I feel like scooping the chair back is a little bit more comfortable for my shoulder. So, you know, go for exploring on this last round. Feel where the circulation repeats itself internally. And acknowledge how the upper spine to the neck has some curiosity how to turn, right? How can you rotate at the base of the neck, even nodding your head or tilting your ear to the shoulder, and turn the core lines. Okay, come back center and let's take the block out. I think that seems right. I think. Okay, place that left foot onto the right knee and kind of turn your body towards the, kind of pivoting towards turning left. The reason being we're going to use this belt. Okay, so what I want you to do is have the belt buckled up. I think this is a little too tight for my hip. So you can change the intensity. You might want to put the buckle in an easy to reach spot. So what I'm doing is I'm seated with my left foot to the right knee and that left ankle to right knee. And I hold on to the hip. Well, it's the connection of the hip joint to the knee layer. And I slide the belt. So the ideal would be it's below the left knee or maybe to the shin, but it's not below the center line of the tibia. Okay. So if I put it too low, it's going to be a little much on my back. So I found that right below the knee is great because I can kind of push forward to get some momentum. Now, if you try to turn facing front, it will take you out of the position. So you want to keep pivoting towards the left. We'll get some experiences with this. And then when you feel your hands to your lower waistline, you're going to lean forwards. And I want you to lean, but flex the left foot. And if you want to make this a little tighter, you can. You might find, oh, that's kind of interesting on my nerves in my hip. But feel where that left knee is motioning out, and oh, maybe it goes a little down, but that's the key with the belt. I'm trying to get this leg to become capable of opening from the leg muscle into the hip joint. You might decide to put your hands so that they're behind your back and give you a little leverage and weight to lean down. But keep it simple. Let's just start with about 30 seconds of this version. You might start to feel the left foot getting a little passive, and that's fine. It passes out of the pose. Foot pass out. Push into the right heel. Inhale, lifting up. It's like it's a bow. And then take that belt with your left hand. I'm going to loosen mine again so I have plenty of traction for my arm. And I hold it in the palm. I'm going to swing the belt back so it's a little more in the center of the back bar of the chair. I keep my legs about the range. If you don't like to sit like this with the foot across, you could sit with the feet hips distance too. It's perfectly fine. But we're working on the hip, so we're still working there. So that left arm, I'm giving myself a lot of range here, so it's easy going. But the armpit chest, feel almost as if you're trying to let that space open up. Good. And the elbow can bend like you're doing a little bit of tricep work, although there's really no weight in your belt, right? It's minimal. But give yourself a moment of connecting to lifting up into the palm, into the belt. That's key. Let go of the idea the elbow needs to be on the hinge and completely bent. You could do that in time. You can make the belt tighter and work with this whole tricep extension. But the key right now is this core muscle. So I want you to, not that there's one core muscle, but this core. So round your back, keep the hand pushing up into that cat spine. Let your head tilt a little down. Inhale, and the belly might not know where to go. And then exhale, lifting back up. Okay, let's do a couple more of those motions. If the arm gets fatigued, your left arm, then of course you can bend your elbow and kind of keep it next to your ear. So find what works for you one more time. Okay, and then as you center up, get both hands behind you to reach to that belt. Be very kind to your arm capacity here. And I'm trying to put my hands in palms together like prayer position through that belt, and my arms are going up overhead. Likely your arms are behind you a little bit. Okay. So feeling the different sensations. One arm is a little more loaded than the other. Okay, and let the right hand now hold the belt. And I want you to just be simple and let the right hand help guide the belt so it's kind of hanging off the right side of the chair. And then let it drop, and you're gonna lean forward for this exact position where you're forward last time on this side with the leg crossed. If you are able to reach maybe towards your wall space, if you've got a bolster and that's an easier grab, you can put your hands on the short end of the bolster near your wall. You got to have a wall for this sequence today. So as you lean down into the leg circulation, let the torso almost use it as a weight. So you let your head lower. Your left hip and left arm are felt. You feel for those areas. So sending support into two places, as well as each other's practice. There you go, Susan, good. Okay, now when you do come up and center, I know the bolster can be nice to push towards. So when you're leaning forward, you'll feel that arch in the spine. I want you to swap the foot crossing, bring that right foot up, and this time we'll go into this side in the first round. So you've already got your setup where you're reaching forward. At least your muscles in your back are warmed up for that. That's why we'll start on the second side with this seated forward hip fold. And if the right knee is, quite lifted, you'll notice when you get the belt around it how that shifts the joint. So feel the body leaning forward, either hands on bolster or wall, and progressively motion your body weight into the legs. Breathing slowly. This way time kind of goes by. Before you know it, you've been in the pose for a while. Anytime, track how you're working with your neck, right? If you need to nod your head a little bit forward and back. And then coming up, we stay the same with the legs. So what we'll do is shift your bolster aside. And then, if you can see me on this side, it's going to be the same as the last side, but I'm going to hook that belt loop around my right leg. And I'm going to turn so I'm kind of kitty corner on the chair. Now, when I pull away from the where the belt is hooked onto the chair seat, I'm trying to get the belt tight enough that it's still connected to the center of my tibia, so that shin on the right leg. Now, let's say you sit back a little bit in this and kind of feel if your knee will open out further. We're trying to work with the position of the pelvis so that the tipping of the waist over the legs, right? So you can bring your hands back to hold the chair, but you've got to be pointing to the right side of your chair so the right leg can be supported. The higher up this belt goes up to the knee isn't necessarily going to be an improvement. Some people prefer that though. So try it out. The belt won't be attached to your hip, right? It's on the chair. So take a few moments, find what works for you to have your hands on the chair or your waistline. Leaning. Okay, a few more seconds. Kind of warming up the hip for our standing series coming right up. You know, when you lift up through the crown of the head, we'll take our belt and we'll uncross the right leg. And I'm going to loosen up my belt a little bit because as I turn to the right, and I make sure that it's on the back of the chair, right? Then as I lift up my arm behind and have a hold of that, I'm going to have it with my feet apart on this side and get a feeling now when you bring your feet in towards your underneath the thighs versus closer into the knees. Feel what it's like to lift up with that right arm and really extend into the arm, the flesh of the armpit chest. And then as you bend your right elbow, it's as if your hand is holding that belt. It's quite loosened up right at that point. And then alternate that lift and lower, and be cautious here of your spine's tightening possibility. So you might feel the weight into the back of your sitting bones, almost as if you're halfway into a cat pose with your spine. So if this is a little bit of an intensity for your arm on the side, your shoulder, then back off, right? You can always stay with a little bit of a bent elbow, or it could be open to the side. And then we'll reach the left hand back to that belt as well, so they both join in, and feel if you can scoot back in the chair now, right? So you're quite far back into the seat of the chair, lifting up. And now mentally notice how the arms have this kind of vigilance here in the body. They're quite full of force, lifting up. Inhale. And then exhale, let go of the belt and stretch the arms open. And take the feet wide as the mat and lean forward. Okay, if you need to adjust your tush on the chair, adjust it. But lower down to a wide stance, fold the hands onto the ground. If you want to reach back to the legs of the chair, that might be good for you to let your head lower down. Some people prefer a block under their forehead and the hands holding the chair, the legs. So let's let the spine center and lengthen forward. Head on a block or on nothing, right? So nothing is okay. But as you lower down your spine to the brainstem, feeling the circulation success in the legs, in the hips. Hands are going to slide forward if they're on the legs of the chair. We're going to go into some movement. Loosening of the legs. So as you reach forward, I know some of us might be hands on the lower bones of the legs to be here. Some might be on the floor. So in studies, this is considered how you learn how to work in towards squat, right? If using nothing under your seat doesn't work for you, you can use your chair to work on squats. Okay. Now, as you bring your hands up above the knees, I want you to toe heel your feet in, and then reach your hands back to the chair seat and lift up and turn so that you're facing the chair now. And you're going to work your way into the feet apart from the wall and forward with your hands on the seat. And then find the right angle for you, whether you need to scoot your chair a little bit forward away from the wall, but stretch into a chair dog pose. So now the legs are fully lengthening and your arms, including the stretch of your upper back into the shoulder, kind of that openness of the spine and your weight of your head down. Yeah, it should feel good to get off of the chair seat and progress. You can bend both legs. Okay, we're going to come to up dog, so it's up to you, if you're far away from the wall with your chair or not. But when I scoot my feet back to the heels up, I'm going to stretch the waist forward and up. So there's length in the center vine of the body. In breath and slow, alternate dog pose to up dog. So we're using the chair as a kind of a lever for our levers to move. So take these moments to alternate at least 2 times, 2 rounds, 2 to 4 rounds, and encourage if you have your hands holding the side bones of the chair, think of the chair bones, right? This is a support for you. When you stretch back your hips to dog, you might palm down on the chair so the wrists can get a little bit of relief. And they're always appreciating relief. Okay, now last time when we come up, what I want you to place is a block at the right foot of the chair. So right on the base of the right foot, well, as you're looking at the chair, maybe it's the left foot, but when I look, it's my right side. And you're going to put your left heel back at the wall and then slide the right foot up so the toes are up and the heel is down. And it's an extremely interesting calf stretch. So when I lower my elbows on the chair and I kind of come to a screeching halt in the position, feel how the hips, even though you think it's your seat, but feel how the hip bones move back. And see if you can work with that reach back through the hips. Right, as if there is a force that's pulling your hips out of the spine, hopefully not. And considering how your knees might approach this, can you keep the legs close to straight? There may be a little bit of a bend for you in one or the other legs, assuming the right leg won't have an ability to really bend. So hold the circulation above the kneecap like you're sucking up the quadricep. Good. Elbows down might be ideal. It might be more intense, but it's likely less pressure on your wrists. Right, all that blood flow into that right leg. It's like it all goes there for these moments. Kind of amazing. Okay, the left heel for me is on the floor, but for you, it might be a little bit up on the wall, and that's okay to change it up. It depends on how your wall is. You know, if you have a little baseboard, those things affect this experience every time. Okay, so as we put the hands on the chair seat, and I try to get a little bit of lift in my heart, like I'm reaching it, I slide the right foot from the block now under the chair seat so the foot is parallel. And we'll bring the right hand back to the sacrum-ish zone. And as you rotate, take a little bend in that right knee, even if it feels like it's taking you out of the revolved triangle, like the discipline of it. Feel if you have a little bend in that knee, how you might be able to control the bottom of the right foot. My left heel is down. I could take a wider or a longer stance here, I suppose, but get a feel for the stretch in both the right hip, but mainly left heel. Great, and then turn, waist. Feel how the waist tries to rotate kind of peeling up into the ribs. And that right arm can either lift or stay at your back. Yeah. And what would it mean to get your arm to lift anyway? Is that going to change something internally, or is it unnecessary for the moment? So you might find it's a good connection from your back heel all the way up through the spine into the right arm when you lift an arm. Breathing. Okay, so get a feel when you lower that right hand down and you shift, palm down, hips levelizing, center the waist. And now when you're in this position, I want you to pivot the back foot. So the outside of that left foot, the back side of the foot, little toe side is on the floor. Heel is pressing in line with the side of the foot. Right hand is down. You're going to turn to the left and lift the left arm up and rotate. So what's kind of nice about this is the inner thigh can kind of press and that left arm can lift. You might get a feel here when you're rotating, the circulation motioning in the legs, but minimal sometimes in the upper body. It's almost like it's a different circulation flow in your upper. You know, it's not as blood filled, right, as the legs, right? They have a little more thickness to them. So let that left arm reach behind your back so you can work on the rotation. So the inner thigh muscle on that right leg might feel like it's twisting the right inner thigh. It's not just inner thigh stretch, it's also turning it up towards the pelvic layers. So I want you just to notice that and visualize half moon pose. Just don't do it yet. So just kind of visualize what muscles you would recruit. And then take a little bend in that right knee to help you guide your torso back center. And then as your hands come down, hold the sides of the chair and pivot the back heel up, right foot steps back. Be sure your chair is on a mat, okay? And then stretch your up dog. You won't want to slide your chair forward. Lengthen your torso. Feel the legs kind of squeeze together on this version. In breath, out breath, shift back. Feel how you alternate your right heel down, and then you'll stretch your left foot up to the block on the left leg of the chair. Be sure the block is really secure. And if the tilt of your foot is a little intense for you, you can always back off on this one. If you don't like to have your foot up on the block, it's too much for your calf, you can have your foot on the floor under the chair and do the same pose pattern, right? So these are clearly different stages. So as we lower the elbows, okay, we get a feeling of the weight into the left heel and the reach back. And I know that the legs are not the same order under your hips. So to order your hips around would be probably awkward. So guide your body so that the spine is in an arch and you can feel the flow of your right heel to the floor and your head centered, I would hope. Okay. Centering your brain somehow, huh? Feeling the left leg and all its kind of little wirings of circulation into the calves. And with a few more moments here, let the brain lower down. Doing the good work. Pacing ourselves with breathing slow. Okay, so now when you feel your body shift a little forward, can you be a little cautious with the back leg? So you want to have a bend with the back leg. Hands, now if I try to progress up, it's like I'm keep reaching through my spine front, my heart center forward. And then as I guide my left foot off the block under the chair seat, you know, we have different, obviously we all have different lengths in the legs. So my distancing on my mat is probably not going to be accurate for you. So I want you to be able to feel like you are kind of reaching for it. You have something to gain from the distance of your chair from the wall. So depending on if your right foot is really heel is on the base, it will affect the whole sweep into the right sitting bone. So mine is feeling really secure in my back leg. Like I do not want to budge my leg because it's so focused. But if your heel is up, it will change things, right? So you decide. But when you start to turn to the left, try to keep that right heel plugged in just like it is starting. Maybe your left hand comes to the sacrum, you lift it up behind you. But when you turn, try to isolate so that your left leg up into your hip, then into your torso is twisting. This back leg is likely going to try to get involved because it's part of you. But your work is really into this left leg. So let's say your left foot is straight in the same track of your right. You want to scoot it a little bit out to the left side. So you have some opposition. It's not incorrect though to turn the right foot out a little bit, right? So that's your typical revolved triangle shape. I'm just trying to work with deepening the sense in my back calf, and then left arm could go up. Yeah, coordinate these motions, lifting, rotating, breathing. Yeah, try not to tackle too much within the experience. That flow of the left arm is completely up to you. I like to feel when my arm is turning that my chest is turning too, to the left for this one. Good. Yeah, so get a feel for that rotation from the inside leg track through the pelvis, through that navel center, and then weaving into the arm. And now let the left hand come down to the chair and make sure that the right foot, when it pivots, open. So the outside of the right foot is touching the wall, that your left foot now, that left heel is in line with the arch of the foot at the wall. And as you press into your left heel, you'll stretch your right arm up into triangle pose. Make some triangles. So as we start to gain our triangle shapes in our limbs, you'll feel where that openness is through that right arm. Yeah, and the right arm could go behind you. It could stay lifting. If you have something to hold on to from your ceiling, it would make it a little more comfortable. Okay, but as the waist turns, be sure that your left shoulder doesn't roll in, right? So I've got to keep this left arm full of support versus twisting the arm. Yeah, that kind of helps a little bit. And if the chair is too far forward, you can slide a little bit in. I want you to feel like you've got something under you to support you. Breathing. Maybe head turns down to the left, down to the chair, and you can gaze at your left knee and kind of notice, is it straight leg? Is it a little bit of a micro bend? Try to push into the left heel, feeling all the points of the foot on the floor. Whatever that means, huh? The points of the foot. Okay, now visualizing half moon. That's our brain cell work right now. We do this in the brain injury classes, right? Visualizing the pose, not doing it, but visualizing. Just consider what that would be. You probably have to flow out from the wall somehow, but we're thinking about balance. And as we start to move the right arm, let's take the hand to the hip. Okay, so you're going to bend the left knee. And you know what I'm going to need you to get is, before we're going to do a wide stance. So I want you to have your blocks over to the right side where your body is. So the right side of your mat, so it's to where you're going. And you're gonna turn to your toes in on the left foot, and you're gonna take a wide stance. So 2 blocks, probably lowest height for most of us, this will be fine. But move your feet back, maybe kind of shift on your support. If your chair feels too close, just kind of shove it a little bit forward if it'll go. Won't go anywhere. And then as you lower down, you'll have your hips lengthening back. So imagine from your heel bone to your sitting bone, scooping around to the buttocks. It's kind of in a position where you're leaning into your heel bones, and then your head lowers down. And if you can get your head down easy, like you're already there, then I would prefer that you take it so that your hands are in line with your big toes and your head is down, your crown of your head is down. But there's no force on your head like a headstand, but it is an inversion. So you have option 1, hands on blocks, head between the arms. Option 2, hands inside line with the toes, elbows bending, head still lowers towards the floor. If you're close to the floor but not quite there, take a block, place it underneath the crown of your head. But if you can almost get there, don't use the block so it impedes your progress there. So position for focus, sitting bones up, spine is dangling right from the pelvis, right? So you're getting traction and inversion. And just be careful that if you are lifting up and down to see what's going on, you might want to be cautious not to all of a sudden stand up and jump around. So keep it easy going, blood pressure is lowering. Likely that we can be here for a few more moments. Settling circulation to the brain. Getting ready for takeoff. Breathing. Now, as you bend the legs, and you're in a little bit of a squat, conundrum there. We're going to use that power that's kind of pulling in the legs, and we're going to start to come into half moon. So what I want you to work with now is you're going to get your blocks close. If you are not using them, get them again so they're under the palms. And feel the sensation of balance in your legs so that you do have a little balance here. It's pretty minor because you have a nice kind of giraffe stance, right? You're kind of supported. Okay, drinking giraffe pose. Now, when you move your hips back, you're going to be using your chair for this one. So I want you to bring your hands onto your hips as best. And when you lift up and you feel the weight into your heels. So notice that I lift up. I mean, you might be a little lightheaded from that forward bend, but feel the weight in your heels and feel how the toes are kind of inwards. So we're going to scoot the left foot to turn towards the chair. So pivot the left foot towards the chair. And as you lean into that lunge, you're going to reach your hand down and use both hands like you're going to cartwheel. I always think of this pose as close to a cartwheel as I'm going to feel I can do. So have cartwheel mind on this. And if you lift up the right foot at the wall, you might be in good setup for this one today. You might find this is too far away, too close, many things could come up. But as you place your right foot to the wall space, you might need to scoot your chair in. That could be possible. Now, if I have my hand on the chair, I'm going to almost kind of cup the hand so I'm not forcing into my wrist. I have a little more arch in the back that way. But lift up the right arm and experiment here with the circulation in that left leg. If you're feeling the weight move to the back side, I'm feeling that kind of the back corner of my left foot. Use the core muscles to keep that lift up. And then I want you to have the legs still at the wall, but turn that right arm down so it's at the chair. But feel how this right hip has to pivot open. And sensitive in your back muscles for this position, probably. Okay, so feel that right foot push. Now turn the right foot at the wall so you're pivoting the foot to turn the toes to face down. It might feel like you're a little far away from the wall for this version, but keep the right foot pushing so it's stable and strong in your glute muscles. Okay, both of them get to work here. Yeah. And now as we come down, we put a right foot down, and I want you to this time go to that second side, but we're going to lift the foot up first, the left foot up at the wall, and get that sense of pressing into your foot. Even if your weight in your hands is dominant, see if you can put some energy right in the center of the body. So it's not about how it looks, but how the energy feels in this right hip. So the right glute should feel some sense of circulation and input. Okay. Turn the left foot at the wall so it's pivoting, and start to notice here if the right leg needs to step a little forward underneath the hip towards the chair. I want you to find a balance point where your movement in your right inner thigh is rotating, and so that left hip turns, right? Even the right inner thigh might feel the circulation. And then lift up the left arm, and maybe you rotate, but the key here is this left foot. It's not turning up to the wall, right? The toes, right, are facing in that direction you're aiming, right, towards the left. So let's keep it simple. The right arm is full of energy, but see if you can turn the waist, lift the left arm up. Breathe. It's all temporary, right? It's a temporary hold. They keep saying that. Okay. So as we rotate, do you feel any energy in your hip, or is it sort of not quite tapped into? So work with that standing leg. Breathe. Okay, now as you lower the left hand, you keep the left foot up at the wall if you can, and turn the foot so the toes face down. Energetically noticing as you step the left foot down and you step the right foot back, we're going to come to a kneeling position. So I'd rather have us prepared for that. So get a blankie, slide it in close to your toes. And then as you lower down, feet at the wall, knees on the blanket. Take a moment here. I know that you want to probably crash down to child's pose, but see if you can center on the chair. And then step the right foot forward and be in a lunge. Push the chair away, nudge it with your knee, just whatever you need to, but I want that foot to be parallel, not turned out, but it's under the chair seat. So you're lunging and you're free to slide the chair, and you're free to bring your elbows down, and you're not quite free out of the sequence, but you're getting your body into this level of conditioning now. Okay, so I'm going to have us have these two options here. One is keeping the lunge low, stretching the front of the left thigh. Okay, front of the left hip is ranging forward. Second option is to keep the chair so you have something to touch to, but you're going to use the weight into your right foot, pushing down and lifting the back knee. And I'm going to hook the toes under so my left heel is actually pushing into the wall. I know the wall is an amazing prop. It takes a lot from this kind of class, doesn't it? The cells in that wall are squirming right now. So feel the right knee moving towards the chair. I know that it's maybe not a quad stretch for you, but if you use the right foot heel down under your knee, you might be able to get up in this final standing set. So we're getting there, but you might be able to lift up into a experience of lengthening and a high lunge. It's not a warrior one pose, the back heel is up, but it is a crescent lunge. So give it a try. Great. Breathing. This should energize you for a sunny day. You got the rest of the day to be out in that sun. Okay, so feel how the lift is in the back muscles. Try to let your bones shift into your right heel, front heel. And then as you lean down to the hands on the chair, it's kind of normal that you want to lower down at some point. You want to come down from the pose. But when you progress back to that lunge on that first side again, feel the muscles in the front of the leg lengthen. And then when you switch sides, you take a breather how you need to. Maybe you need to put your hands on the floor. Be careful of the chair against your head though. Round your back into cat and alternate the arch, cow. And then change the side. So we step forward left foot and we lunge and feel the difference on the second side. Yeah, let the chair be pushed away if that's helpful for you. Just let it be. Cycle your focus into the front of the right thigh. I know this, the bones work is a little higher, well, it's higher density for your bones than generic kind of restorative. So if it's a pretty kind of thick, intense practice, maybe just graduate into each cycle at your own pace. Okay, so feeling the fullness in that back leg. Anytime you want to come up, let's say you're ready to lift now, you can let that back heel push into the wall, adjust so your foot is stretching the fascia of the foot. The plantar fascia gets a nice stretch here. And then we might be able to move our hands away from the chair. You might stay with the hands of the chair. Let's say you need the chair. You could also turn the chair so the hands are on the bar of the chair. If you need some more height, like under your hands to lift up. So when I lean back, I try to get the arms to reach up and adjust my mind into the eye focus in front of you. Find a gaze, looking at a still point, and emphasize this kind of core bundle from the front of that right hip down to the into the psoas, right? Or it goes up from the hip to the psoas. But you can feel this whole tundra of muscles working and lengthening in the right hip. Breathing only helps. Okay, now lower down the hands so the back can edge out. Feel as you lower the right knee back down. Now, when we come back with our left knee, I want you to slide the chair off of your mat, okay? And we're gonna add a bolster now. So I want you to place your bolster in front of you and take a whole stretch down on top of that. Lean into it. Let your thighs touch the bolster, okay? Lower down so you have as much support as possible under your elbows. And if you need to push away from the wall so your feet aren't so pushed into it, I want you to, well, obviously your feet are pushed into it, but it depends on your length in the front of the thighs, right? So I like to get a little bit more reach through my legs. So try to get the knees so they're off of the floor and use that height of your bolster so you can kind of surf out here a little bit. So you can push the palms down, feel the arch of the spine, and you're coming up into a little more of a full baby back bend. It's a full locust pose, right? The hands are though on the floor in front, and it's a wide span with your fingers. And the heart might feel a little bit of pump right from the last sequence we were working through. So lengthen the front body. Give a few breaths here. Now lower the knees. They might casually kind of touch down and lower the elbows into Sphinx pose. Feel all that bulk under the body, right, with the bolster, bulky bolsters. And then as you slide your hands back, we're going to push into the palms wide, come up, back to table. And then I want you to go ahead and take a side sage And you might use the bolster just like this. You might push a little forward and then use your left hip on the blanket and then come down this way. This is door one option. But let's get this side worked out. Door two would be I'd pivot my bolster like this, and I'll put a block, even though it seems a little bit minute of a support. If you have an extra towel or blanket, you can put that on your block. And then I'll come into the pose this way, right? Maybe with a block under my right leg, distant from the wall so I'm not jamming into the wall with my leg. And then come into the side reach. So my block is on the second height. Arm is spanning open. Right, so the options are a couple with the bolster. Now the work has been fairly intense for, 50 minutes really of standing upright patterns, a little in the chair seated, but for the most part activating. So when you're starting to shift into kind of full circulation modality, right, into a little restorative bones work, feel where the right arm can open the chest. Just that upper right rib cage. Breathing. Let the left hand relax. That might get a little bit busy trying. Great. Now, when you start to shift out, I want you to take the focus to come into a Baddha Konasana pose, so reclining. So when you sweep that right arm down, we're going to take the sand away for a mini moment there. And then we'll pivot our weight down to the bolster. And then as you turn, have your blocks under your knees. But here's what we'll do is we'll turn our bolster to the back, pivot, swing the blanket so it's under, well actually it's on top, and I'm gonna have to bring my blanket so it's in a little more of a fold, a little higher up, right? So I get more support for my neck because I don't have as many blankets that are set right now. And then when I pivot to the wall with my feet together, I'm going to scoot my bolster real snug to my sacrum so my feet can stretch, my toes can stretch. We know that's good for our feet. So as I put the blocks under my legs, I can add sand to my ribs. If you don't like sand, or you have two sandbags, you can put one on each inner thigh. So I'm going to use the blocks quite distant from my legs. Right? So they're under them, but they're not holding up the whole piece of the leg. And it's the particular balance that you'll work towards here in feeling your arms open, your shoulders back, the sides of the waist relaxing, but they're open. It's not a downward pressure with your torso. It's not downward gravitational slumping. It's the opposite of a slump. So with the inhalation kind of gravitating towards the sense of 10 pounds on it, and exhaling, letting go. Okay, feel how the muscles in the walls of the chest, depending on if you have sand or not, might move to the experience of breathing more if you have some weight on it, versus if you don't, it might stay all in the belly. So there is some nice contributing energy, right, with the sand weight. Let the abdomen, however, relax. Soften the belly. If you don't like the feet touching the wall, you can always scoot them a little bit away so they're just sole to sole. That's completely fine. Your happiness changes moment to moment. What is comfortable? Okay, last few moments here. If you're enjoying Supta Baddha Konasana, you can always stay as long as you like. Scan where you feel the circulation strengthening, right? In your ankles, in your knees, in your hips, and your low back. Such a great pose, right? For overall strengthening of the circulation and the strengthening the immune system, right? The flush of the inner thigh, the lymph. Now, when you do sort out coming into your next side stage, I know we all have some experience with prompts, so usually you can organize them within moments. But feel how you organize your muscles to get into the next shape. So just be slow. You know, let the knees point up. Let the feet separate. Kind of feel how your hips maybe shift a little side to side, like you're wagging your tail. And then when you start to turn to the right hip, you know, I know we have the blanket change and all that, but if you don't want to change the blanket, you don't have to. You can turn to your right hip. You can decide now, right? You can go, well, maybe this side, I'll use the same direction, but some different props. So you can put your block at the head towards where your brain is, your blanket on top. And then I like to have something on the inside of my left leg. So get a little bit away from the wall. And then add that sand. Now your hip on the base might not like to have nothing under it. So it's really up to you if you have a blanket or a towel under your right hip. But as you reach the left arm over, work with that length of the waist. Feel the circulation through the ribs and blend movement of the breath. So the sand could be on the hip, it could be higher up. Turn it so it's on the side. It's kind of like a banner on the side of your waist, isn't it? Your rib a banner, the weighted banner. Okay, that left arm is flowing either overhead or it's open or it's relaxed on the side. Be here for a little bit of time. If your left leg is getting a little tired of its position, you might need to stretch it a little back or use the block on the inside. But carry the focus specifically for your leg and your torso. Good. Give it a few moments, breathing. Yeah, as the wrestling in the leg bone starts to calm down from our standing poses, start to notice that your concentration in your muscles is getting a different type of density now, right? It's the coordination is going to change. So now as that right hip is heavy, left arm is going to reach down to that sand and slide it away. And we'll sneak our way into bridge pose. So I want you to feel the knees close-ish. You're kind of in this fetal position here. So you're gonna roll in towards that right hip. And now when you come up, let's take our bolster off to the side. And we'll place our block. Well, you might just have them both next to your feet, I think. The blanket could be under your head, or you could scratch that idea entirely. And we'll lower on our back with our feet up at the wall. Yeah, some days the blanket feels really good, and some days it's like it's a no-brainer. Don't use it. You almost track your neck circulation. If you've been forward bending a lot or hunched over doing some chore, it's likely going to be helpful to have the blanket. Okay, depends on what you were doing before. Okay, all right, so I've got a block And if you have a ball, you can use that between the knees too. They're just lighter. That's kind of the benefit. Even though I know this block isn't very heavy, but the ball is even lighter. So you're going to squeeze into the object between the knees. And when you squeeze in, it doesn't matter what one you choose, just choose what you're comfortable with. You know, you don't have to touch under your back, but notice there's a little bit of space. There's a little hollow at the lumbar junction there to the sacrum. So I want you to let that space be. You don't have to tie your shirt around like I am here, but you want to notice that there's a little space there. Keep it, let the space be. And then you'll want your other block, keep it nearby. Okay. Now push into the wall with your feet and now lift up the hips. Walk your feet up a little bit at the wall. I know you got a block or ball, so it's a little more energy, but as your hips lift up, feel the spine circulation. Feel the hips lifting. Inhale. And then exhale, lower the spine down. Inhale, lift the hips up, stretch the arms overhead. Exhale, lower the arms forward and the spine down. Okay, now the heels might be just touching, but the toes might come off the wall. So that's what I want you to aim for. It's like your foot flexes when you lower your spine down. So inhale, lift up so your foot plants into the wall when you lift your hips up. You can't help but have your feet at the wall. And then when you lower down, you're going to feel the foot flex. There you go. Inhale, lift up the hips. Feel the feet push into the wall. And then exhale, lower the spine down. Okay, last time we lift up the hips. We feel the feet push into the wall. Feel the hips lift up. And this time you're going to, actually you got to shift it down, lower down and move the block from between the knees. If you've got just a ball, you're going to need a block for this next one. Lift your hips up and center the block under the back of your pelvis and feel how the back of the pelvis presses into the block and then lift both feet up in the air. There you go. Let's see, someone got unmuted by accident. Let me see what I can do. Okay. Huh. That's funny, Floyd. You got unmuted for some reason, but you're back to being muted again. I thought something sounds like somebody's here besides me. Okay. All right. All right, so when you're here and the spine is lifting, my hope of all hopes here is that all that leg work we do in the beginning is kind of, the strain from it is draining. You're not draining like you're completely tired, but it's not so, you know, when you get wired up from doing exercise, it's kind of starting to drain out. You're using the exercise to basically stimulate your immune system. That's one nice thing about standing poses into restorative poses in a practice. It's like your full little science project here. So work on opening up the chest and the shoulders kind of squeezing under. The blanket is not required, but keep in mind now you're in more of a legs up, a little more of a shoulder stand variation. Not a required blanket, but I want you to bring your palms forward so they're towards the wall. The palms are open. Now I can never get the shoulders down and under enough on this one. It just is always going to be something I can improve on. So feel the shoulders almost as if there's someone grabbing the shoulders and trying to roll them down and in towards the floor. It's got to only be you though, your circulation. Now visualize if your legs could go higher up, right? Let's just say you had all the shoulder powers in the world and neck flexibility and your legs could go up, right? Higher towards the sky. So that's a visualization work, is that lift. So the leg tone is full, like you're lifting up the roots of the toes. You're pushing through the foot like you've got little heels on, right? So you're pushing through the balls of the feet towards the ceiling. Okay? This is the most you're going to get with that expression in your foot for a while. Really feel the foot working. And then as you relax your knees bending, I want you to bring your knees to bend and then feel your feet to the wall again. Now walk the feet up so that you have some height with your feet at the wall. And you've got to be careful with this transition. So push the whole heel into the wall on both feet. Now lift up the pelvis off the block so you are in more of a shoulder stand now, right? This is much more shoulder standish. And then bring your hands up to the eyebrows of the buttocks, right? So they're right up at that upper buttock zone. The elbows are down. I know this is a lot on arms, on wrist and strength. So do the best that you can to hold yourself up. And then I want you to stay with it for a moment, push your feet into the wall. That's the key. Try not to rock your neck side to side. Try to keep it stable here. Okay, and then as you slide your block out, off to the side, you're going to bring your hands down, palms open, and then slide the spine down, vertebrae by vertebrae. Ease the back. Okay, and then feel when your back muscles come all the way to center on the sacrum, center on the sacrum. Okay, you'll bring the right leg, cross it over the left leg, arms spread out. If you got your bolster in your way, just kind of slide it. If it's really, really in the way, you can slide it back behind you, back behind your shoulder, for instance, if it's really in the way. But you're going to bring your knees into your chest and then let the knees go to the left side, so you're twisting. So make sure that that twist is supported. If you need a block under your knee on that left side, just take a block, or let's say you need your bolster. You can add sand to the outer right hip or stay simple here. This feels like a pretty productive position without any props for me, but again, you might like some extra support with your hand on the outer right leg. The right shoulder is trying to get down, trying to lower down. Turn your head to the right. That will add some weight to your shoulder. I mean, it's a couple pounds at least, huh? It's going to add circulation. Take a few moments here. Notice how high in the lower back that the twist goes into the thoracic vertebrae. So you feel the mid vertebrae twisting. And your upper back is also in a rotation. Good work. Breathe. And now as you come back into letting go of that hook of the leg, slowly shift it back into the middle, uncross, and then take the left leg over the right leg. You don't have to put your foot at the wall. There is a little advantage if I start with my right foot at the wall and then cross the left leg over, because it stabilizes the right side of the pelvis, the right SI joint. So these are kind of good things to know about helping your back out as things occur in your body. Sometimes you need to have something basic to do to help out your low back. This would be a good one, the bridge pose, and then a twist starting with your foot at the wall to help you cross over. You might not add the shoulder stand if you've got some back stuff. For instance, you're doing some therapy for it, but we did today for a full class kind of set. We'll keep going there. So let that left leg cross over the right, foot is off the wall, and your left arm is open, head turns to left. Eyes resting. Relax your impulse to effort more. See if you can keep it simple. Simple sensations. Kind of collaborate between the spine and the hip. And do a little scan of your experience right now so that when you find your final pose, which still has exertion in it, in bones, we do either legs up the wall or shoulder stand in the chair. So just scan your body and notice if the energy is kind of cycling to have the legs up a wall, or if you're going to try using the chair. Okay, so take a few more moments here with the crossover, the hip crossover. If you have sand on the left hip, use that. If not, keep it simple. Stay with the breath. As long as you're here, you can stay with your breath, huh? Now feel the spine lengthen as you bring your knees into happy baby. So knees open to the spine in between. You kind of feel that that lowers down, and you can rock side to side when you hold the sides of your feet. It's a little easier rocking position than if the knees are just tucked together. You know, you have a wider span at the base of the spine into the back of the pelvis. So we're going to move to our final pose, and you really decide, right? If it feels like you want to go legs up, I'll show that. And if you want to use your chair, you can adjust to get a blanket on the chair seat, on the pad on the chair, and then a bolster at the foot. So those of us coming into legs up the wall, Viparita Karani, we're going to roll to the side and come up and get our, we'll sit up basically, not lift all the way up, and put a bolster at the base of the wall, okay? So the difference with the chair is that you have your bolster at the foot of the chair, the feet. So what we'll take is our blanket for those of us legs up the wall. Does anybody legs up the wall? Susan had to go. So you know what? We'll do the chair shoulder stacks. I think you both are. Yes, so we'll do that. Okay. So chair shoulder stand. I know you got this belt kind of stuck on it. I don't think it should bother you. I don't know if it will, but I'm going to kind of put mine off to the side so it's not going to tangle me up. Okay. We've got our bolster. Okay. And we've got our blankie. All right. So as you're ready to come in and lift up, be sure you got a little space from the wall. You know, I like to do shoulder stands sometimes with my feet at the wall for the chair, but it's just not ending up that way. So I'll be careful. Okay. So I'm lift my legs up, and now when I lower back, get a feel here, the condition of that. I'll go glasses free. The condition of your musculature in your chest. So when you have that length of your body getting so inverted, it's pretty cool that the shoulders, for some of us, we're using the blanket on top of the bolster, and that works better for the height, but really get this kind of feel for the back of the pelvis. And then when your legs might go to coming up, get a feel for the full lift up of the legs. So you'll notice that if you start pretty centered on the chair, you're going to get your proportions nicely lined up for the back of the pelvis, straight up into the feet. Yeah, so aim for feeling the bolster with your shoulders a little bit. Try to let it be so that your neck has that length and the shoulders are motioning back and the throat is open. Even swallowing in this inverted place. It's a lot on your body, right, to be inverted and do all its operations, but it's also a rest for the organs from their downward pull. So it's great, great, great for the thyroid. That's one of its focus points right now, is the circulation into your throat center. So don't hesitate on feeling a little bit of that chin scooping in so you circulate in the thyroid and the parathyroids. And if the shoulders are not really capable of pushing back, just relax into what you have. If you like to close your eyes, but you still feel safe, okay. But sometimes just having a little bit of a gaze, looking up towards the feet is helpful. Good. Spatially open the channel of the heart. Let the belly flow with the breath. Is your sacrum resting on the chair? And if your hands are holding through the legs of the chair, feel where there's a secure hold, but not so much hold that you're tightening your back. So you want to have almost this kind of nice hold to the sides of the legs of the chair, reaching through. And it's completely fine if you're not grabbing onto the chair legs and you use the legs of the chair to just keep your arms in this position to open your chest. So it's fine if you relax your fingers as well. It does take a little more balance though in your legs. Start to bring your feet to the back of the chair, the bar, so the feet come together, the knees move open. Be sensitive to your redirection in your balance, in your spine, into the legs. Circulation is pretty dense in the inner thigh. And dense doesn't need to be tense, right? In some ways that can be put together in sensation, but you can feel the density flow. Now take the time when you transition to go slow, and as much time as you are able to be in this inverted state, right? Your circulation in your respiratory system changes. So when you shift your knees to point up and your feet go to the seat, plug into the feet, slide the arms out, and then start to guide yourself back onto the bolster. Slide down, take the care that your neck is comfortable. Situate your hips on the bolster. And you'll find it's a little different in your nasal passages from being in that other state into here. The nasal passages slide and center. And deep breath. Now the legs could be in a real casual space, but what I want us to do is give ourselves a few moments as we kind of shift out of our back. So give it time here to transition. So your spine is centered and your shoulders are broad. Give yourself a hug, reach your hands around to your shoulder blade ledges, right? So you can feel that flesh that is a little loose on the sides of the shoulders. Try to reach to that space. So it's kind of armpit flesh. And change the crossing of the arms, opening up the shoulder blade. Relax the arm connection. And then as you bring your feet to position to help you roll to the side, be aware of your surroundings, to let your hands bring you up, and maybe sitting to either the back, so your back is at the chair back, right? So you can sit with your back touching to that chair back, or sitting on a bolster anywhere. Spine up, hands center on the lap, and then maybe they slide and glide to unity in front of the heart. Relax your gaze down and find that bow connecting into your heart space. Breathing in support to yourself, but it means more, right? When you're connecting to others, awareness externally out there, maybe way far away from your room that you're connecting to. And exhale, bowing into your heart. In gratitude namaste.